Hi and welcome to Mogola Stories from the Road. My name is Anil और मेरे साथ हैं Dr.
Hi, I am Dr. Avnish Seth. Yes,
Dr. Avnish. Dr. Avnish Seth, यहाँ के what is your position here?
I am heading Manipal organ sharing and transplant.
Manipal organ sharing and transplant. What's the acronym for this?
Acronym is MOST.
MOST.
Yes, that you have lived your life. And then after you go also make the most of it by donating your organs.
Okay, so how are you going to make things different? I know you've been in the military, you've served as a colonel in the army, and wahan par, tell me what you did with the army and organ transplant and organ sharing there.
Actually, it all started way back in 2006 when our liver transplant team went to England for a training for 6 months to 1 year. And we realized that there was no disease donation, that when people die donating their organs, that program was lacking in the country. So we thought we'll give it a go, and we made AOTA, the first nice acronym, Armed Forces Organ Retrieval and Transplant Authority.
Tell me a little more about that. What is it?
We, same thing, promoting organ donation, getting systems in place, SOPs, declaration of brain death.
Since I speak a lot to army jawans and men and women in the uniform, they often ask me, how does one do this? Since we're in the army, we're not allowed, is what they say.
It's not a question of being allowed. You can all pledge, anyone can pledge. But when it comes to organ donation, it all depends on that fateful day when you're suffering from a head injury or a stroke, and one is on a ventilator. So that time the family is what counts.
So this is specifically for the
deceased donor. As far as living donation is concerned, in the army, a serving soldier donating could be a bit tough because then they may become unfit for extreme work that is required, you know. And that is one thing that is need to be sorted.
So now that you're out, we can actually have this frank discussion. You just said something that could be controversial. Now, if a serving soldier gives up his kidney or liver, you're saying that he could be unfit for extreme. What would that extreme be?
I'll tell you what. I know that you represented India in the transplant games and all that, but everyone may not be that lucky. If you donate half your liver or a kidney, chances of complications as you go are always there. You know that, everybody knows that. And the requirement of a serving soldier is very different from a requirement of a person in the civil street. So if you're in the infantry and you want to donate a part of your liver, it could affect your career, and you may not be able to go to Siachen, you may not be able to go to the battlefield. And what army needs is fit soldiers. So other family members should step forward rather than the guy in uniform.
Now, would it be prudent enough to say that, okay, that could be a thing and then they could end up becoming a category soldier? But what if they were to prove their fitness with anyone else that hadn't done it?
Yes.
At that moment, should that be okay?
Why not? Absolutely. We have people who have donated. It's not that they've not donated.
So it's on a case-by-case basis?
Case-by-case basis.
Okay.
And it all depends on, firstly, if we have other family members, they should realize that this person is in the army and they should be donating rather than them. But then, if it is somebody's life to be saved, then so be it. You donate and then take it from there. Nobody will stop them.
So it's not like it's 100% sure that once they've given it, they will be category, even if they're fit and lucky to be fit.
That depends on the policy, which keeps changing from time to time. I'm out of service since 2009, so maybe
things could have changed. All right, so back to Manipal Hospital. What is your swan song over here? Now that you're here, what is your aim to see happen?
I would love to see disease donation happening when people die after brain death. We should be utilizing their organs, because living donation, you are a great proponent of that, but you will agree with me, it's limited to donation of a kidney or half a liver. What about heart transplant? What about lung transplant? Pancreas, small bowel? So if you have somebody donating after brain death,
now you said pancreas and small bowels. Isn't that even after a cardiac death you can give that?
You can give all organs after cardiac death, but then that protocols are still evolving in our country. So right now let's stick to the basics of the heart still beating and the person brain dead, and we try to talk to the family, and then since the heart is still beating, the blood supply to the organs is still on. So we have 1 or 2 days in which we talk to the family and try to take the organ. So while in living donation, I'll be happy to tell you that India does the second largest number of organ transplants in the world. The data is now available on the international websites. We have amazing expertise. We hardly have complications now. So as far as living transplants are concerned, living donor transplants, liver and kidney, I think perhaps we have the best experience in the world now. And after US, we do the second highest number of overall transplants in the world. Having said that, 80% of our transplants are living. I would like to see 80% disease donor and 20% living. Why are we disposing away our organs when we die? I can tell you that we lost my mother-in-law. She was 75. She had a brain hemorrhage. But then the family, especially my father-in-law, had the guts to donate. And today she is alive in 5 people, and that is a great source of happiness in the family.
No, I won't hold you to it if you don't have the exact number. But amongst all deaths, just say in Manipal or in Delhi, what percentage of them are brain deaths?
If you look at overall deaths, that becomes a bit out of relevance. Let's look at patients with, say, neurological death. That means organ donation would occur when the brain is dead.
Correct.
So what we are looking at is head injury, strokes. So we did a project when I was in the armed forces in our IOTA, which is published, the first study from India, that if we have somebody dying of a head injury, then 1/3 of the time we could pick up brain death before the heart stopped. So all over our country we have 99,000 ICU beds. That is the number of ICU beds we have in the country. And if we look at it like that, if you say how many people die of head injury or stroke?
No, brain deaths.
Yeah, so out of that, if 10,000 dying of, say, brain death, that would be a reasonable number, which I feel is happening, but we are not picking it up.
Great, thanks a lot, Doc, for your
Thanks a lot,
quick insights.
And looking forward to your talk
Looking
now.
forward to our talk. Thank you.
Bye-bye. Come meet it.